But then when you made me think about loyalty and I started thinking about mission, others like that, Mark Cuban,
Okay.
gosh, what he's trying to do with lowering drug costs and creating transparency and using his brand and using his marketing chops and his courage to get out there and to just ruffle some
Ruffle
feathers
the feathers. Yeah.
yeah, I admire that because it's mission based.
Welcome to the Loyalty by Leadership podcast, where I, Daryl Moon, your host, interview people who have been inspired by leaders, as well as leaders who strive to inspire, where we discuss leadership, insights, and strategies that add value and create loyalty. Welcome. I'm pleased to be joined today by the CEO of Redirect Health, David Berg. Dave's a great friend of mine, and I'm looking forward to our conversation today about loyalty by leadership. Dave, why don't you start by just maybe doing a quick introduction of yourself, and then we'll get into the podcast.
Yeah, sure. Thanks for having me, Daryl. So I'm David Berg, CEO of Redirect Health. And we're a company here in Phoenix, Arizona, but our clients are all over America, employees and employers, all small employers. And our mission is to make healthcare accessible, meaningfully accessible to people who've got hourly jobs, and for the businesses that employ them, and to give those businesses incredible recruiting advantages and retention advantages. And we do it by managing the logistics of healthcare on a technology platform.
Well, and Dave, one of the things, before we ask you about leaders that you admire, that I've always admired about your company is the fact that you can recruit employees to Redirect by creating an immense loyalty by saying, we're going to pay 100% of your healthcare.
Yeah, and it's not just for them, but for their families. And quite often the loyalty happens at a 10x level when you help people take care of their children.
Yeah.
I mean, their whole families. I can't even imagine what it would be like having healthcare myself, or healthcare peace of mind myself, but not having it for my family.
Well, and just tell quickly the story about how you and your wife came down from Canada and went, this is crazy. Healthcare's a nuts in this country.
Yeah, when my wife and I, she's a family physician, and when we moved down to Phoenix in 1995, we did not know what we were doing. We were kids. We didn't know how the system worked, and we were pursuing the American dream, probably like every other immigrant around the world does. And we were pie in the sky kids, and we got here, and gosh, we got hit in the face with that pie. CPT codes, ICD-10 codes. This is before HIPAA. This is before like all the things, before electronic medical records. And it just didn't make sense. We couldn't make the math make sense. And we made a lot of mistakes at the beginning. Many of them are because we brought a Canadian perspective into the United States. We made some, crazy mistakes. And just to show you how green we were, to level set, we were smart but not very knowledgeable. And but we still have Canadian holidays because we didn't know that Americans had different holidays than Canadians that were statutory holidays. So that's how green we were. We still have Boxing Day after Christmas and Good Friday before Easter, for no other reason than we didn't know any better. And now that we did, it became tradition. But the one thing we could never really get our heads around was how in Canada, we don't have even close to the level of healthcare quality or quantity that we have in the United States. I mean, the United States has the best healthcare in the world. It did back then in 95. It still does today. It's where every person aspires to come to if they have a major healthcare challenge. And however, in Canada, there was incredible peace of mind around healthcare and the cost of healthcare and the access to it. In the United States, it was really odd to see so great healthcare with so little peace of mind. And we could figure out, my wife and I ran medical offices and surgery centers for a long time, 30 years here in Phoenix. And so it wasn't hard to make money in the healthcare system. It was quite easy, actually, once we learned the rules, how to get more codes, more visits, negotiate for higher rates. It wasn't hard. It was easy to do. But one thing I could never figure out was, how do I make this meaningfully accessible and affordable for my own hourly employees? That was seemed like an impossible deal. And I just got sick of it after 10 years of trying. And I said, I'm going to put my brain on this. It's all I'm going to think about until I solve it. And the answer was, it's never going to work for the hourly employee the way it is today. It's impossible to work. And that's back when deductibles were only $1,000. Now their family deductibles can be $18,000. So
Yeah.
I'm going back in time to 2007 when I designed my own system for my own company. But that's the reason I did it, is because I was on a mission to create peace of mind around healthcare accessibility and affordability for every single one of my employees, every one of everybody in their family, every man, woman, child. And at that time, we only had 54 people. Now we got considerably more than that, hundreds now. But back then it was a small team that we were trying to really just reproduce what we had already done with our own family, the peace of mind that my wife and I, Janice and I, had already created for our own family and our neighbors and our extended family and our friends. We'd created incredible peace of mind. And so we just retro-engineered it for our own employees. And then it wasn't too long before a really good friend today, Paul Johnson, and partner of Redirect Health, he was the mayor of Phoenix. He saw what we were doing, asked me to help him with his construction company when he finished being the mayor in 1997, I think, and his brother's company. And we saved a ton of money by helping people navigate through the system and avoiding unnecessary activity and waste and administration and bureaucracy that didn't create value and that took them off work. And we used the telephone a lot. And it created incredible peace of mind for not just our own team members and their whole families, but for friends. And we did that for many years. And it wasn't until 2013 that we decided to turn it into a business. And we had to.
And now you're doing it for hundreds of employers across the country.
Oh yeah, many hundreds, and all 50 states. And so the idea of eliminating unnecessary activity and unnecessary waste in administration and bureaucracy, it seems to withstand the test of time. That you eliminate those things, you improve the value, you help people have peace of mind, they can access it. And it is quite incredible to see the difference in the peace of mind that we're able to create for people, that in the contrast between before they start with us and after they start with us. And sometimes the biggest challenge we have is they don't believe the peace of mind. They don't want to have that peace of mind because they don't believe it. They don't want to be disappointed. And that quite often that's our toughest challenge is
change. Yeah,
it's change in the solving the too good to be true. But we are really big in creating peace of mind and confidence before you need healthcare, that you're going to be able to access it and you're going to be able to afford it. And we've created hundreds and hundreds of process and systems and ways of doing that. And it is one big complex system, as you know, and everything's connected to everything. And if you think any healthcare journey is ever going to go exactly as planned, you haven't seen a healthcare journey, because I've never seen one, and I've seen millions and millions and millions of healthcare journeys, and every single one of them gets off track somewhere. Exactly. The key there is you got to figure it out right away, diagnose that they're off track, and nudge them back on track, or bypass the bottleneck that's experienced. And when you do that, people get the care they need all the time. And people get the right price all the time. And people now can afford it. And there's a price point for everybody. We've got a lot of healthcare in the United States, and we've got a lot of money that's in the system already, that if that money was just redistributed or redirected, I don't like the word redistributed, but redirected it to a place where it can create greater value for the purchasers, the employers and the users, their employees and their family members. We've got plenty of money in the system. We don't need to add more money to the system to make it work well.
Oh, absolutely.
That's my soapbox anyway.
I appreciate it.
Don't let me go down the road. You know I'll be there 8 hours.
That's fine. That's fine. So, Dave, tell me about some of the leaders that you've experienced or you know of in your life that you admire the strategies that they deploy to create loyalty amongst their followers or amongst the people that they lead.
Yeah, I'd not really thought of the question from that frame until you asked it earlier. And what's interesting is my normal go-tos, like the Elon Musk and the Jeff Bezos, the people who accomplished like incredible things, they weren't on the list, though they're very accomplished. But because you asked about loyalty, and you
specifically,
and we have a lot of loyalty in our company, so it really made me have to think. It wasn't obvious to me who those leaders were, but you made me have to think about how we create loyalty, how I create loyalty. And there is no doubt I'm not the nicest person in the world. I'm not the most charismatic. I'm not the one with the best speeches. Like there's so many things I'm not. But one thing that's really hard for anyone to compete with me on, and I feel very confident in, is the area of mission. When it comes to the mission of what we stand for and what we're going to do, what we did in 2013, what we did in 2008, and what we're going to do in 2033 and 2053 and 3000, it's really obvious to me what we're going to do. And so that mission is strong. So you made me think about that. And then when I started thinking about the other leaders that I've read about or been exposed to or met, I specifically thought about the mission-based leadership that I've experienced or I've read and learned from, even if I've never met them. And so when I think about the leaders that inspired loyalty in me, I think of names like Larry Ellison of Oracle. And for the reason being is he's got all the money in the world. You cannot give this man more money as far as I know. I don't know. I've never met him. But why is he tackling the data and the infrastructure of healthcare with the excitement that he is? It's fascinating to me. And to the point where when I was selecting a database, I picked Oracle because of him. And when I was selecting an accounting system, I picked NetSuite on Oracle because of him and his mission for healthcare. And I don't know if it goes anywhere that's useful to me. I could have picked anyone. He got my loyalty because of his mission, because of that mission. And I suspect in his life, he's done that with mission in the past. I don't know that for sure. The only other place, or another place I've heard Larry Ellison mention was Mark Benioff's book, Beyond the Cloud. And Mark Benioff talks very lovingly about Larry Ellison and helping him start Salesforce. And so Larry Ellison is somebody that came to mind. It's somebody that I've admired his work, but then when you made me think about loyalty and I started thinking about mission, others like that, Mark Cuban.
Okay.
Gosh, what he's trying to do with lowering drug costs and creating transparency and using his brand and using his marketing chops and his courage to get out there and to just ruffle some feathers. Yeah, I admire that because it's mission based. Sometimes it could get a little personal, and I don't know Mark at all. I don't, and I've never met him. I know some people who have met him, but I've never met him. But I admire how I can only imagine that he inspires incredible leadership with the people around, or loyalty people around him, because his mission, and it's not just he just made it up. He's been on this kick, as you know, forever. When my friend Doug Ducey was governor of Arizona, Doug brought Mark into town, and I got to listen to him at a tech council years ago. And I never spoke to him, but I'm going, man, this guy gets healthcare. He gets the complexity. He gets the problems. He doesn't have the answer yet, as far as I know, but gosh, he understands the problem the way I do anyway, the complexity, the hidden costs, the perverse profit incentives in the industry, that get in the way of peace of mind and meaningful access. So I've really followed his stuff for a long time. So, and I think he inspires my loyalty in that, he's become political, and there's been people who have, in my world, that have said disparaging things about him, and I'm the first person to go, hey, you don't know the whole picture. What about this? What about this? So he's got my loyalty. I've never even met him.
Well, and I love how that loyalty can be more than just your own team that you're leading. It can be your customers, because you just talked about 2 or 3 companies that have your loyalty because of their mission that you connect to.
Yeah, and I love the way they lead. Somebody else that I just met, I met him in December, was Mehmet Oz, who's now the director of CMS.
Oh, yeah.
Yeah, before he was, I didn't know it at the time. He came by for a couple hours. We talked. We had a mutual introduction, and I adored everything he was talking about. He was so into, and he's the person that I guess I was thinking about before, but he was so into caring about public policy and creating meaningful access to healthcare for people and affordability. And now he's influencing public policy. So where Larry Ellison is on a mission, I believe, I'm not talking to him again. I'm putting connecting dots here, to change the infrastructure of healthcare so it can work. Mark Cuban, the transparency of what's going on as far as costs. Mehmet Oz, I mean, he's influencing public policy. I have no doubt in my mind, if he's given the chance, he will influence public policy. And I know that he didn't get the position first and then want to influence public policy. I don't believe that.
Yeah,
I think he wanted it first, and that led to it. Somebody else that we know that is influencing with mission is Dave Chase of Health Rosetta. He's empowering employers to take charge, and the brokers that help those employers. And if you think about it, they're all doing something different. All of them. But what they're all doing the same, which I know you and I love, is, and that's why I know that these names, what they're doing, these missions are resonating with you too, is they're all democratizing healthcare. So there's something for everyone. Yeah. Right. And that is a mission that made sense with me when I lived in Canada. Now, we didn't do it as well as we could in the United States because we don't have the same kind of healthcare. Right. The same, but we have Canada at least had the snapshot of what success might look like as far as peace of mind. Nice.
I just read recently 1776, and when you mentioned mission, I couldn't help but think of this book that talks all about George Washington. Yeah. And historically, I think of George Washington as this guy whose face is carved out of the mountain as the father of our country, And yet this book is one story after another, how George Washington failed, how he just blundered things, how he made huge mistakes, how he blew it over and over and over all the way through the year 1776. And it wasn't until I'm thinking, as I'm listening to this book, I'm thinking, is this ever going to get any better? I mean, you're not giving me a great impression of this father of our country, right? Yeah. And yet he was true to the mission all the way through. And he took a lot of hits because he was making a lot of blunders and people were getting hurt because he was making a lot of mistakes, but he was stuck on the mission. And at the very end of the book, of course, he crosses the Delaware. He captures the town of Trenton. And of course, it was kind of the big first success. And of course, 8 years later, the Revolutionary War and they won. But the point was he was focused on mission, and his mission has permeated time. It wasn't just his own ranks and his own people and the general that he was, but his mission of what this country could be like still permeates this country. And that's what I got out of the book. So when you said mission, I couldn't help but think of that.
Yeah, think about it too, is what he was doing when he was doing it. He had no idea that it would work. And if it didn't work, he was going to be killed. I mean, there's no doubt about it. So, and there's no way he continues the way he did if he wasn't so into the mission. The persistence would not have been there.
He would have given up.
100%. And I've given up on thousands of things if I wasn't into the mission. Many things have conquered me because I wasn't in the mission. Not this one. Not yet. I don't think it ever will. I've been doing this a long time, just like you have. And so the people that are around us, they understand that. They understand we're not going to bail on this mission. And I think that's important. That's my way of inspiring loyalty in the people that are around me. And I'm sure there's some other ways, but that's the easiest way I've come across.
So going beyond mission, can you think of other strategies that come to mind, either that you try to deploy or that you've seen other leaders try to deploy that build loyalty in addition to mission?
Well, obviously, you've got to care about people, or they're not going to be able to follow. They've got some human needs, right? So think about Maslow's hierarchy. People got to take care of the basic needs, and they got to know that they belong. And halfway up, you got safety, and then you've got what do you got next? You got physiological needs, and then you've got love and belonging and things in the middle. So the love and belonging is a necessary part. And then when you start getting above that, that's when you start talking about the mission and helping other people. But you got to make sure that people feel like they belong and they're loved and they care for. And they're cared for. A saying that we say around here is care more than the world says is normal.
Say it again.
Care more than the world says is normal all the time.
Oh, okay.
So if the world says that this is a level of normal, take it a notch up. As soon as that becomes normal, do it a little bit more. Yep. And it's everybody's job to care more than the world says is normal. And that means about each other. It means about our customers. It means about our vendors. It means about our enemies. Anybody. Let's just care a little more than is normal.
Have you read the book The Go-Giver?
Yes.
Okay, I think of that book when you say that, care a little bit more. The whole book is about this principle that if we expect to give more than we expect to receive, we'll be wildly successful in our personal life and in our professional life. And I love that notion. Care more than is expected. Like, it's okay to give more. And when employees feel like you are giving more than you expect from them,
Yeah.
and you care about their personal lives, like you take care of their whole healthcare needs at no cost to them, man, that goes a long ways.
Yeah, and I think as far as tactics for inspiring that loyalty around mission, you got to live it too. And as a leader, what that means is put a poster up on the wall that's not quite done, then change it with a marker. And then put another poster when there's enough marks on it, and just let people see it over and over and over and over and over and over. And you know when I always know that I'm starting to get through is when people start making fun of me, when they start mimicking my voice, or they start, well, you know what Berg would say or what Berg would do. That's when I know I've got them. Is when they start making fun of me, and because and then once they do that a bit, then they'll start owning it. But there's a stage between me saying it and them owning it, and that's usually the part where they offload some of the risk on me by making fun of me when they're leading their people and reminding them of mission and drawing pictures for them and drawing whiteboard drawings about how our mission reflected, or when they're telling the story with emotion about how, hey, I talked to him, I talked to a member last night, and she didn't have to go to the emergency room. We have to take her on the phone, and we do it every day, and we forget how impactful it is. But I just talked to Mary, you from Idaho, and working for ABC Manufacturing Company, and you know that she can't afford to miss a day of work. And she was so worried about it, we were able to get her worry down. So we can tell stories that are around our mission. And that story I just told you, I've heard that hundreds of times. I don't get tired.
No, because it's personal to them.
Yeah.
And it means something to them.
Or hearing a story, you always hear complaints, right? Any business, you hear complaints. But when you hear the client that goes, man, I never, ever thought I'd be able to offer healthcare to 100% of my employees. Wow, this is like a game changer for me being able to recruit people or retaining them, or not being able to have the wage pressure of somebody offering $1 more an hour down the street. Like, this has changed my business. Again, I love those stories. And so part of being a leader is making it great to tell those stories. Even though we might have heard them 1,000 times, celebrate the 1,001th time that somebody's telling that story, a different version of it or the same version. I love it when we talk about a story that happened in 2013, because it's still in the memory of the company. And so as a leader, to encourage that. And I've not always been the best person to do that. I'm the guy who's naturally wired to, yeah, that's done, check it off, let's go get the next frontier. Let's go get the next hill. I'm that guy. That's my natural state. But I've learned that like embracing our mission and going back and celebrating it with people and being the one who's starting the celebration is important. And so if I were to think about tactics, it would just be my ability to care about our mission and to talk about it in an unreasonable way, more than people think is normal, to the point where not everybody, but there's enough people who become unreasonable with me, and they're also telling the story.
Yeah. So you created something very unique for small employers. And quite honestly, the small employer feels like they're left out. Large employers can do all kind of self-funded innovative plans, but the small employer, they don't have a lot of options. So I'd love to give you a chance to tell more about Redirect, and specifically how you've designed a solution for small employers that create that feeling of peace of mind.
Okay. So I did have some advantages in that I ran healthcare clinics, multi-specialty clinics, primary care, with all the services of primary care we need in order to be successful. We had X-ray, we sold them now, but we had X-ray, lab, mental health services, preventive services. I mean, we had musculoskeletal services, physical therapy, chiropractors, like all on site in multiple centers all over Phoenix area. Even outside of Phoenix, we had very quick to adopt electronic medical records back in 2003. I had no supporters when I did that in 2003. I'm telling you, that was hard too. But by 2010, everybody's starting to talk about it. But we had a lot of head start on collecting data and being able to use the data to manage the logistics of healthcare. And so that's where we started out. So I had a lot of advantage because I was doing it to make a living.
Right.
And so then now when I had to engineer something for my own employees to make it affordable and accessible to them, I kind of knew where the waste was. And I really knew where the waste that created profit revenue for somebody existed. Like I knew that an antibiotic could be $2 or $400 for the same pill.
Yeah.
Like, I knew that. And so I said, okay, well, that's an easy one. I'm going to sell that one. That's easy. I knew a baby could be $3,800 at this hospital, never any complications billed for. Maybe they were there, but they weren't billed. This is back in 2006, 7. Or this hospital, a mile away, it was now $8,000, not $3,800. And there was always complications being billed for another $10,000 or $15,000. And I'm going, this is craziness. And any entrepreneur, you let them write their own check, they figure things out pretty fast. So I was that entrepreneur, but I also ran medical clinics, so I got to see the logistics. So I had a lot of advantages with that. And so when I went and did Redirect Health, I was really just retro engineering what I already did. My wife already did, really. Mom with a medical degree is my wife, not me. And we've used that term today. It's part of our storytelling. I saw what Mom with a medical degree, my wife, Janice, did with our own family and her extended family of neighbors and family back in Canada. And it was really about managing the logistics so that people got all the care they needed. We managed the logistics because that's where the cost was, right? Logistics could be this pharmacy versus this. Location of a pharmacy can create that $400 change. Air ambulance versus a telephone call. That's just logistics to us. Incredible cost differences. So I saw in our own family that all the costs were controlled best, not by the care people needed or keeping people healthy, but by managing the logistics when they needed care. That's where the first layer of savings is in managing logistics. And then figuring out also what the right price was. But logistics had to come first. What logistics do I need? What urgency, what time, what location, what form of transportation, all the logistics things first. And then I figured out what the cost was. And now last, I would figure out what's the best way to pay for this. Because if I get that MRI to zero, because you don't need it, best way to pay for it is easy. But if I get that MRI to an X-ray first, and we'll do the MRI later if we need it, right? Instead of going to the emergency room where you 100% of the time get the MRI. But when you get the X-ray, it can be $600 or it can be $30. Well, what if I can get it for 30? Well, now who's going to pay for if I get it to 30? You can. It's cheap. It's easy. So if we get rid of the cost, you can take care of it. If we get the cost down to a reasonable level, you can probably take care of it. If you can take care of the cost of that medication or that imaging or whatever it is, if you can take care of that cost, you now have an agency. You don't have to rely on insurance companies. You don't have to rely on networks. You can start really taking care of your family. So we recognize that early before we even started using technology. But as I mentioned, we started with electronic medical records early. So we started seeing the value of data before it was a cool thing to look at the data. And then the patient-centered medical home with NCQA, National Committee of Quality Insurance, came out, and we were the data we were collecting and we were using in order to improve the customer experience and improve access allowed us to have level 3 standing without even doing any work, just writing the test.
You'd already done it.
We'd already done it. So we had some huge advantages. And we were saving a ton of money in our own company. I would say back then we were spending about half of what anyone else was spending on healthcare. Today we spend, using my own system, I bet you I spend 20% of what anybody else spends. I bet you I spend 20% of the normal and about half of what my clients spend because I use it better. I hire better with it. I just use the whole system better because it's part of our company mission, right? If you make widgets somewhere in Alabama, I really don't want you thinking about healthcare as your primary thing because it's not you make widgets.
Make
right?
widgets better. Yeah.
Right.
Let me take care of your healthcare.
Yeah. And we take care of the healthcare and other employers just step into it. We expect them to save about half as much and then to put half of that savings into more people and to get the 100%. And that's the mission we're on. And our clients, we love the clients that embrace that mission. They don't have to right away. Some of them, it's years later before the light bulb goes off that, wow, this is a powerful capability I have to offer free healthcare in my job ads. Free healthcare, you and your children in the job ads. I think it was Molly Maid taught me that one. Free healthcare, you and your children. That was Molly Maid. I thought, oh, that's smart. That's so smart. Think about how you compete, right? If you're a maid company. Anyway, so we say entire family. So it's just a game changer. Without even trying, we get easily 2,000 resumes a month, over about 25,000 a year.
Yeah, no, you've told me that for years. That's been a huge recruitment loyalty aspect. I'm sure it has a lot to do with people wanting to stay with you because they know if they leave and go work someplace else, they're going to be paying a ton of money for healthcare.
Yeah, it puts a lot of pressure on us, on me, is because we get people who are working for us because they love the mission. But you get a lot of people. It's not as easy to advance people through their careers at the speed and the magnitude they want. Sure. And sometimes I hate it when somebody feels a little stuck because they can't get healthcare anywhere else and they can get a little stuck. So that puts a little pressure on me to always be growing, always be advancing, look for the people who are ambitious and try to set up a pathway for them to grow their careers before they start asking for it. If we wait till they ask for it, we don't have time. And we're focusing on the wrong things. But if we can identify the people who are ambitious and they're smart and they're young and they just want more out of life. You know they're going to want more. I love those people. I love working with them. And I love brainstorming early about what does that look like for you 5 years from now? What does it look like for you 10 years ago? It's definitely not answering my phones 10 years from now. You're too smart for that. You're too right? It's not that there's not a pathway on answering our phones 10 years from now, but I want you to answer the phone so much better 10 years from now than you are today.
That continuous improvement, both in their personal life as well as in their career.
Yeah, and it's not just about answering the phones. It's about creating that. We call it the I matter feeling. The I matter feeling. Right? I want the people that we interact with. I don't care if it's a taxi driver driving somebody into our office. I want to make sure if we're interacting with them, I want them to feel like they matter. Yeah. In all the normal ways you would make somebody that you would say, gosh, I matter right now. If somebody smiles at you in the street and they're a stranger, you're probably going to smile back because, somehow I matter right now. Yeah. There's a human need to want to matter, and we want to create that I matter feeling. And so if somebody's going to be doing a similar job many years later, that's okay. But I want you to be 100x better at creating that I matter feeling.
Yeah. So Dave, how would a listener, whether it's an employee or an employer, get a hold of you?
Well, I got David Berg on LinkedIn. I don't even know that's an easy way. My email is david.berg@redirecthealth.com. And
the website is redirecthealth.com, right? So if somebody wanted to jump on your website.
Easy to get a hold of. I have not had that challenge of being bothered by lots of people trying to contact me. It's not that I don't get a lot of people contacting me, but I don't mind talking to people. I quite like it. Nice. If it's about the mission. I can't tell you how many times I have had people get through and they don't want to talk about the mission. They want to talk about how we sell more something to our members. And I go, no, my goal isn't to sell more of anything. My goal is, and I explain to them, I say, hey, I'm happy to talk to you about your hearing aid, whatever it is they're selling. But help me understand how this makes our membership more valuable. And our membership is more valuable when we create incredible access to care for people, incredible peace of mind for people, and we lower their costs. So that's what makes our membership valuable. Can you tell me how your solution can do that? And it's rare that people have an answer to that.
Yeah, because they're just looking to sell their product.
It's usually about how do I sell more and how do I get a higher price?
Yep. Yeah. No, I experienced that myself. How can your coaches promote my nutritional, supplement or this wellness product or this exercise piece of equipment? It's like, no, that's not what we do. We're not going there. Yeah. Well, Dave, this has been great.
This is you and I got along so well. If you recall, we were talking about mental health and how do we make that more accessible, more affordable to people, and we just brainstormed of what a perfect situation is. And the truth is, I couldn't have built what we built for our mental health program on my own. I couldn't have built it without you, and you couldn't have built it without me. So
Right.
that's what made it so special, is that together we built something that neither of us could have built separately, but it was all around the same mission of creating accessibility and affordability, wasn't it?
Absolutely.
It-
Yep.
and
Underline.
it's all we talked about. It's
Underline.
all we talk about today, 10 years later.
Exactly.
Yeah.
Dave, thank you so much. I appreciate you being a guest. Any last minute comments or messages you'd like to share?
Well, let me leave with this. I do want to, I want to encourage you to keep doing what you're doing. I know you've been a champion of this cause, probably with not even close to the recognition you deserve or the gratefulness from others that you deserve. So I want to encourage you to keep doing it. And,
Thanks.
it matters to me. And it would have seemed corny to put you on that list of leaders that inspired loyalty by mission. It wouldn't have seemed corny, but you're definitely on that list because it's got staying power. It's obvious that you care about this.
Thank
And
you. We're both passionate about the mission.
yeah, at the end of the day, we're taking what you're doing and Larry Ellison and Mark Cuban and Matt Oz and Dave Chase, what they stand for, and we're just making it real for every business and every employee right now. That's what we're doing. That's our role. Is we want to make that real. I don't want to be in the public policy game like Dr. Oz. I don't want to be in the information systems software business like Mr. Ellison, or I don't want to have the pressure of the like taking the arrows about price transparency like Mark Cuban. But we all have our role in democratizing healthcare, access to healthcare, so there's something for everyone in America. It's a worthy cause. It's a worthy mission. And there's lots of people that I'm not mentioned that I'm sure care about this. And so you doing what you're doing right now, and you keep doing what you've been doing for years, you never know. That person might not even be born yet, who's going to be the person that takes this democratization of healthcare access over the edge for America. They might not be born yet, so we don't know the influence we might have.
That's true.
I just want to encourage you, keep going with it. It is a worthy mission.
Appreciate that. Thanks, Dave. Well, thanks again for being with us, and we'll catch you next time.
All right. Appreciate you. Thank you.